NPM1, the protein gets aggregated. And we find that the mutant which cannot aggregate cannot do the chaperone activity. Neither it can induce the transcription. So, the aggregation of the protein or oligomerization of the protein, better to say, and the acetylation is a key factor for RNA polymerase II given transcription by NPM1. At this juncture, okay, fine, we have found all these but what is the significance of it? I was trying to correlate this finding with the physiological or pathophysiological situation. So I contacted Dr. Gopinath, the founder of Bangalore Institute of Oncology, present director of the Jalappa Institute of Oncology in Kolar. So Gopi gave me very interesting samples. Oral cancer sample, buccal mucosa sample, some of the tongue sample, and right from the land of Karnataka. And what we find that as the grade gets upgraded, NPM1 expression is high. And so as the acetylation NPM1 is high. This is the first signature came out from the patient sample. So what we thought, if we down-regulate NPM1 in the oral cancer cell line, what will happen? By using a cell line we made by DOX-induced cell line, and then DOX-induced shRNA, if you put the NPM1 expression is less, the moment we find the NPM1 expression is less, we find the migration has come down, invasion also has come down significantly. When NPM1 is not there in the oral cancer cell line. By the way, these cell lines are not any cell line from buying from abroad. This is the cell line from Indian patients. Okay? We created a tongue model. Okay? This is the model created by Tesi from RGCV. And there, as you see, when NPM1 is there, in the day basis of that, the tumor progression is high. And this tumor is also showing the metastasis. If you down the tumor NPM1, the tumor growth has dramatically come down, tumor markers also has come down, suggesting that the NPM1, at least the function of NPM1, directly connected to the oral cancer manifestation, both in the cell line as well as in the orthotropic model. Okay, we did an RNA-seq analysis, presence and absence of NPM1 in these cell lines. And what we find, a very important genes are down-regulated in absence of NPM1, which is related to angiogenesis, apoptosis, and also large number of RNA polymerase II given transcription. So, and then we validate this data that indeed these genes are what we have seen down regulation. We can do by RT-PCR. And we find if NPM1 is not there, these genes are down regulated. So we call in vitro chromatin transcription, come to the cell line experiments, gone to the animal experiment, and then we come with a very specific RNA-seq analysis. And then what we try to see whether acetylation is required, oligomerization is required or not. In the cell line, when we shut down NPM1 and then put back the mutant, oligomerization mutant or acetylation mutant, we find that the migration or invasion has come down, suggesting that the NPM1 gets acetylated by P300. It's also P300 acetylates the histones, and it induces the oncogenic transforming genes in the oral cancer as seen in the patient sample and seen in the animal model. Well, why NPM1 is overexpressed in oral cancer? There are many reasons. To cut a long story short, what we find that mutant P53, I'm giving you just one slide on it, but many work has been done by us. This mutant P53 gets recruited by AP1 transcription factors, and this induces the NPM1 expression. By the way, NPM1 people have explored it a lot for the blood cancer. This is the first time it is being shown in a solid cancer, connecting to the epigenetic modifications, and first time we are talking about that it is regulating the buccal mucosa oral cancer. Then we did the large number of patient samples. And these patient samples, as we find out, the tumor versus normal, there is a clear signature of acetylated NPM1. So this indicates that this could be a diagnostic marker. So now we are creating the recombinant antibody, and we are now addressing 1,000 patient sample from the different parts of Karnataka as well as different parts of the country, and see that whether we can have acetylated NPM1 as one of the factor for the oral cancer progression analysis, and whether it can be connected to the therapeutic connections. Just in this context, I want to say you that where we have established a center called Center for Precision Diagnostics Therapeutics Research, and this institution is going to now look after that specific